Senior Behavioral Health provides short-term inpatient services to adults ages 55 plus who have mental and physical health needs. It is recovery-centered in its approach, and it strives to help individuals to not only address their mental health needs, but also reconnect with their hopes and their personal motivations. Here now to talk more about this program is Dr. Aaron Brodsky, the Medical Director of Senior Behavioral Health at UNM Sandoval Regional Medical Center. Doctor, thank you so much for being with us. This is never an easy conversation to have with families, when elderly start having mental health issues. But in terms of figures, how common is mental illness and mental health issues among the seniors in our communities?
Sure. Thanks for having me. Depending upon the statistics, you'll see anywhere from 1 to 4 to 1 to 5, 1 in 5 seniors who suffer from mental illness. There's some uniqueness to the population because their bodies are changing. Sure. Physiology is different. The way they react to medications are oftentimes a lot of medical complications associated with being older. In addition to which, their life situation is changing. They're no longer necessarily working, and they become more socially isolated. So it can be a very difficult time in some people's lives.
So what does the Sandoval Regional Medical Center offer in terms of help and in different programs that you guys deal with?
Sure. Our particular unit is a acute crisis stabilization unit for psychiatric issues associated with seniors. We're 12 beds, as you mentioned. Typically our patient population are 55 and older, some maybe younger, depends. But we try to get them obviously stabilized with regards to their psychiatric issues, but also reintegrated back into their lives and with their families as much as possible.
Because that's really the important thing at the end of the day, is getting them back to that as best you can.
Absolutely.
So what are some of the most common issues that you deal with in the unit?
Sure. The most common diagnosis we probably see on our unit, dementia and the behavioral and psychiatric manifestations of dementia, as well as depression of all kinds. Those tend to be our most common diagnosis there.
Do you see a relationship between those two, dementia and depression, because having gone through similar things, you see a family member kind of going through this issue.
Sure.
They have some sort of recognition they're going through it.
Sure.
And it spurs on depression.
Sure. Absolutely. That sort of a reactive or an adjustment to the changes that are going through with that person can absolutely trigger some depression. Additionally, we have depression independent of a dementing process that we have to look for too.
Yeah. So if someone out there watching, they maybe have a family member that is going through this right now and they're thinking of the best place to go, they want to find out more about the Sandoval Regional Medical Center, how do they do that?
Well, they can look online at our Sandoval Regional Medical Center site. They can call us directly, 994-7887, and we'd be glad to take any of their concerns, calls they may have.
Okay. Now, Doctor, just finally before you go, why did you choose to take this position as medical director?
Sure. The challenge of reaching a new community in an area of study, an area of treatment that I love. I'm passionate about taking care of seniors. We're passionate out there. I love taking care of seniors.
That's really important, folks. So if you have a family member that is in need of such services, head over to CASA.com. Of course, we will have links to the UNM Health Services there. But for now,